Shall I start?
Yeah, I'm ready.
So, hello everyone. Good afternoon. Namaste and welcome everyone. Thank you for joining us for today's webinar. My name is Geeta Patil from Agastya International Foundation. In this webinar, we will hear about innovations in medical field during COVID-19 crisis. So, before starting the webinar, I would like to thank Corona warriors who are our doctors, staff, teachers, scientists, social workers, and others who are ensuring the delivery of essential goods and services. Let us start the webinar. So I would like to welcome our speaker, Professor Kusal K. Das, Professor of Physiology, BLD Vijaypura, and Dean of Environmental Health, UNESCO Chair, Life Sciences, Armenia. So welcome to our webinar, sir.
Thank you. Yes, I'm here. Thank you very much.
Thank you, sir. Thank you for joining us today and giving your precious time. And last 15 minutes, we will be taking questions from your viewers. So if you have any questions, post them in the comment box. So welcome to our Innovation Express webinar series. You know that everybody is talking about the main topic, highlighted topic in the news, newspaper, and in every field is COVID-19. So everybody will talk about coronavirus. So the coronavirus outbreak has brought the world to a standstill, with the business around the world shutting the shop, the economy taking a severe hit, and most countries being in lockdown. So it also affected the education sector. So all of us are fighting COVID-19 the best way we can fight. So, sir, you want to say something about this before we start the questions?
Okay, thank you, Mrs. Geeta, and thank you all the organizers to invite me to deliver a interactive session with all of you. And it is a very important and timely talk. I think that this type of seminar is more important, specifically from the people and the persons who are from the teaching or service, or these people from this background are more important to understand. And I just like to say first that can I just know that who are the audiences? So I will be speaking in that way. Otherwise, I should not go too much depth of the medicines and all. Just the speakers in general perspective: school teacher, college teacher, school students, college student, PUC. These are the which you just want to tell me that which level. So I will speak in that so that they can understand very easily about the whole phenomenon. Can you tell me the?
Yes, sir.
They belongs to average. Who are these?
College, like school students, teachers.
Right. Very
yes,
good.
sir. School students and teachers and our own Agastya staff, sir.
Okay, right. So thank you. So this is important for me to tell about that. The first of all, that I like to tell that this seminar talk is mainly on the innovations during the corona in the medical sciences. So I will restrict my own views mainly on the medical and the health science sectors, and specifically the invention part in that ways, including the drug discovery and all. So like to tell that this disease and all, it is a phenomenon, because I think the world will be remembered in future as pre-COVID and post-COVID era. The way it will be divided, like that the AD and BC, it will be divided in this way. People has changed a lot. In last 6 to 7 months, the whole world is changed. It is shaken. It is not believed. It become completely shocked, and later it became completely surprised every day, new and novel ways. And later also they understood that they have to live in this environment for longer period as it is expected. This is the most important part. Because initially when it has been identified and it has come out, it is not thought of that mess in such a level of its impact on the globe as such. But now people realizes that after seeing havoc in multiple countries, and specifically peoples of India or the subcontinent like Pakistan, Bhutan, Bangladesh, which are belonging to a specific economic zones and the cultural and the social status, they realizes the first impact when they find that the Western world has given a massive dangerous impact on this virus. So they become panicked. Then when the Western world had so much of advancement of the science, technology, specifically in the medical sciences, not able to handle one virus. So what will be the fate when it comes to this part of the globe? And exactly it happens, this part of the globe, we came in the later part. And we have seen the impact and we are going through the impact. Now we realizes that we have to stay with it for more than expected time and duration. So we need certain aspect of our preparation of mindset. I will tell here that as it was in the 2 months or 3 months before when our Honorable Prime Minister has given the nationwide warning that how it is going to make and all, I'm sure that people did not realize at that time this impact will be
Yes.
so severe. So many
Yes.
people make a fun on it. Many people cut the joke. Social media uses it as if that these are the things our Prime Minister wanted to send the message, but actually he did not. He wanted to make us alert and also ask us to get self-responsible in the different ways. We made the fun, we made the jokes, even though we know that what is going on in the Western world, still we did not realize this. Now we understood that how serious this impact is, and also we initially, I think the month of May, June was we are literally in the puzzle stage that what way we are going, because graph is going on increasing and it is not being flattened. So much of they are thought of it that going to be flattened by seeing some of the country very well they have managed. But ultimately it does not happen. It is exponential growth is still going on. But question of impact when it comes, it is in a different way. I think all these things I will share with you as per your queries and questions which you want to ask me, and that will be better to understand. I will try my best to keep it in the level so common persons, common people, specifically my students community, my dear student community from the school, P school,
Yes.
they can understand better way. So I ask you now, this is the background of the whole scenario. Now you can go ahead with what you want to ask to me.
Thank you, sir. Thank you so much. So my first question is: does medical field was aware of coronavirus before the coronavirus pandemic situation? So, if no, when they got to know about the virus, and please tell us a brief history about virus, sir.
Okay, thank you very much. Yes, I think that medical fraternity or any government or the state network all over the world really not expected this type of impact on a specific virus to come. But I will not tell that completely not they are not aware. I will tell that there are a lot of signals have been given. I think that if you see the history, you'll be finding last 10 to 15 years, series of viral, specifically from the China, are continuously coming to the world, even though we try to ignore it as best as possible way. The thing is that we did not understand the impact. Even though when it has gone to the other part of the world like Africa, specifically the Ebola virus, we should be more alert of that. And thank God, all previous virus, whether H1N1 or H1N5 or the Ebola, somehow it has been controlled, or the SARS-CoV-1, it has been controlled somehow, and it has not gone beyond its local or the pocket or the cluster of places invention, infections and the restricted on the zones. It has not even gone into the endemic level also. Though I think in Kerala 2018 there was the virus which has also made certain type of impact. We I feel the scientific community, as a scientist, I believe, as a medical scientist, we are knowing it. It is not that we do not know. We are expecting that such type of phenomena may occur because there was a warning signal clearly. I will also tell the doctors are also be careful about the viral symptoms because of repeated viral attacks in the different part of the globe, specifically from the Southeast Pacific countries, Vietnam, China. China is the most important country who has continuously given the world multiple virus, including the latest one. So these actually we supposed to be alert. And second point, that why we should not be alert. We must be alert because biological weapon is one of the most important parameters which may decide the third world. Third world war will be decided by biological world, and that is known to the any scientist, whether he is physicist or medical science. And I believe each of the government are aware of the biological warfare with the virus, maybe one of the most important weapon for the virus. So I will never say that we are not aware, not at all being completely knowing. Scientist community, government, state community are partly knowing it. Perhaps that is the reason that some of the country they did better, where the healthcare system is more prominent. But shockingly, what happened that it has not exactly come to the picture in that way. First, when the SARS-CoV-2, or which earlier has been first known as a novel coronavirus, reported by WHO in the December 31st, it was surprising that the impact was actually happened in the month of November, September to onwards. There was a changes in the conditions, geopolitical, healthcare in the China was gone and it was unnoticed. So that is one of the things puzzled still many scientists. And it is also known that there are certain problems maybe occur, but not sure. But WHO has not exactly aware of that. I will not blame WHO. I will think that WHO did not have that networking or did not do that exercise which they're supposed to do it. But definitely they are one of the responsible persons to inform. So after that, when the WHO reported on 31st of December 2019 that yes, there is a epidemic disease found in the Wuhan city where a couple of people affected with an unknown disease where symptoms are severe acute respiratory distress. And also people are affected in such a way that they are it's so serious and so severe that many of them are hospitalized. They require the ventilator support. This also WHO informed. And still then genome sequence of the virus not known. It is first actually isolated in the 7th of January and 12th January globally it knows from the China. Again, they did the first isolation of the genome and known that it is a virus. Then WHO then given it the name that it is the novel coronavirus. Later it changed the name of severe acute respiratory syndrome coronavirus 2 because such virus was earlier also there but in a less lethal and less impact way. So this is the brief history of that. But once it has been found, the China has done the work which they say that they have closed and locked down the whole one city, disconnected from the others. That they successful in a very unique way. They got success. I will tell their success if they whatever the claim is true. But there are a lot of controversy about their belief and trust because there is no free media like India is in China. So question there is always big question comes when the question comes on China. So it is benefit of doubt only I can tell they have controlled well so that it has not spread to other countries. That is well evidenced. But what happened? Business relationship with the China was going on. So people were moved from here to here. Many of the European countries, including Italy, were extremely depending on the consumables and product from China. Their business has shifted to the China. They have absolutely no business in Italy and many of the countries. So Chinese connection to the business and all make the air transport. Virus did not came by work. So it is the air transport they have come. And Italy is one of the country and followed by Spain who too much depending on China for their economic growth. Even Italy has all the sea coast has been given leads to China. So such a country first affected and very badly. And very interestingly, Italy and I think say it was actually the second best healthcare system in the world. Specifically, the Lombardy region were greatly affected. Their hospital systems are excellent. And my own experience, because I have been in the Italy, I was in the Rome, I worked there in Sapienza University. So I know the healthcare system of the Italy is how refined and how polished it is as compared to other European country, even almost better or near or better than UK, which is NHS system, another victim of the whole affected. So this is the way I will tell this virus has made impact through the air travel, and I will tell it is the global communication person actually made to spread it very rapidly, and it has been affected the countries which are more depending on the Chinese, where from it virus has been imported and ultimately affected very badly. And then European Union has no passport zones, so they transferred again by themselves by non-European zone culture of the non-passport zone, so they travel and they spread. And there are certain other events, mega events have been done that also spread. This is the way it has been done. Later it has gone to USA. So this is the brief history.
Thank you so much for briefing us about the history, sir. We were curious to know about the history of this virus. So, and the next question is how this coronavirus is different from other virus, and what are the studies going on in the medical field on this virus?
Thank you very much. This is a little bit scientific questions, but I have to keep it in the mind of my listeners. I'll be keeping it a short. And I'm very happy that in this program, some of my doctor students who are PhD under me are also here. They're listening. So, but it is not for them. It is for the common students and all. So what happened here? This virus, I have already told you that the multiple virus in a series of events enter in the world. Specifically, the Asian countries are more affected. But Africa, Latin America also, and also US partly are being also affected by some of the virus. In this case, the first virus and the same corona. Corona means crown. It has the virus structure look like, I think it is very famous now, famous than anyway. I believe that coronavirus is more famous and its figures are more prominent in the newspaper than any film actress or actor at the moment. So it is more famous than Julia Roberts, I must say. Now coronavirus figures, everybody knows it. It has a crowns. Crowns are actually like a spike types, is characteristic. Same type of character was in there in the long back, nearly decade, that is called SARS-CoV-1, the severe acute respiratory syndrome. It was same like that, but only thing is that it was not as lethal and it has not made the endemic too much. In a very clustered zone, it has been restricted and it has been controlled very well. And but it has very interestingly same symptoms what SARS-CoV-2 is having or novel coronavirus. It has the same type of activity or action on the human body by which novel coronavirus also work. Mechanism of actions absolutely no different of the both previous and one, but unique way this virus is different. It is lethality is different. And one thing, this is an mRNA virus. This is for the young students. This is an mRNA virus. So it is not a DNA virus. So it is an mRNA virus. There is a single strand mRNA, and by which it does its work. And it has the protein sequences in very less in numbers, so it can manageable at any. But one interesting part of that, because of the small chain of proteins, amino acid structures, so it can actually change in a different mutation form very fast. In a very long protein chain, whereas the amino acid sequences were changing, a small 2-3 amino acid may not impact that high. But here it is not like that. Here in a single 2-3 change, you make a different characteristic and all. That is the actually the severity of the SARS-CoV-2 and the lethality also. Beside this, there are virus from the African country, specifically from the Ebola. It was one of the very big headache for the African country. It was almost, it has been dangerous way it has been spread. But we have also found the same coronavirus characteristic and the structure, similarity of that is in the Middle Eastern respiratory syndrome called MERS-CoV. It is again the coronavirus. So we can say that actually a lot of earlier viruses having the structure, similarity, nature by this, but it did not have that contagiousness as this virus. It did not have the lethal impact on that virus. It did not, earlier viruses were not having the global impact in a pandemic format. This is the first virus in my lifetime I am saying that, because previous one was the Spanish flu. So these 100 years in the history, the pandemic is very rare in a lifetime. So yes, this is the way we can say that yes, this has been done. So these viruses have been done. But now question is that medical research. The question, second point you asked.
Yes.
I will not tell exactly the medical research. I will tell the whole scientific world, sociological world, literature world are actually doing exclusive research on the coronavirus. There are doctors, no doubt, the frontline warrior. There are others supporting healthcare staff. Okay, they are the front line. But research question, when it comes, technology comes from physics, mathematics, chemistry, biology, all together, including the mind and body conjugations, and also the traditional informations and traditional knowledge to improve. So various way research has started how to do the work. Now, research strategy will be two. First strategy, there will be three strategies. First, to prevent the spread of the viral infection. So first strategy of any healthcare system. So there are research and then how best one can do it. Kill the germ or be sanitized, and what are the things best way to do it, what are the place and where chances of viral infection are more, how to control. This is the first line of strategy. Second line of strategy will be the treatment, who are affected, how to treat. That is also been now refined. WHO has given guidelines, but Indian government did an exclusively very nice work for Ministry of Health and Family Welfare for designing under the supervision of the ICMR. It is wonderfully they made the line of treatment. Some of the great institutions like premier institutions like AIMS, All Institute of Medical Science, they have given a guideline. CMC Vellore also recently given a guideline how to treat and all. So there are mainly multiple treatments have come based on the research. So they have done this part, the therapeutic research part. Then it comes the drug, what way it will be treating when it is a question of drug. As such, virus has no drug to control. No virus can be killed or it can be eradicated by any medicine. This is a wrong concept. Virus comes, virus goes by its own way. We have to suffer symptomatic treatment, like I have a fever, I have to control it. I have a vomiting, I have to control it. I have a diarrhea, I have to control it. Only this is the way the virus has been usually controlled. There is no actually drug so far been directly involved to say that, yes, this is the drug for coronavirus too. There is no, as such, the drug. But it has been tested. So research has started mainly based on what are the treatment modules can be done. It has noticed that these viral actions are in the two ways it occur in the cell. Suppose the virus entered in my body, how it attacks. Two part is the most important: nostrils, nose, and mouth. Also eye, another contact sites. And once it goes inside, by which it enters, then it is affecting the two important parts. First, the cell where it affected, it touch the cell, change the cell whole phenomena, penetrate, spike of the corona inside. So for that reason, a spike or corona to enter in the host cell to get affected, because virus is always dead in the environment, it is alive in the living cell. So when it entered, it required a host cell receptor. Medically, it is called as a receptor, which can receive this viral head and allow the head to penetrate the cell and go inside. I think the young students, minimum, they know it, that this is the cell membrane structures and all, they get inside. And then they do havoc as such that. So it has to first penetrate the normal cell inside to get that disastrous effect. So one drug target should be this part, to block the viral spike binding with the host cell membrane so that it can prevent virus not to enter into the cell. This is the first line of actually research in this for the drug development has been thought of it. And it has been found the receptor for this virus, same like SARS-CoV-1 or SARS-CoV, it is the ACE2 receptor, we call them. It is called angiotensin converting enzyme 2, a specific medical term. I don't want to use a specific receptor they found. They also found that associated with the receptor, some other cofactors, supporting system required. They also found certain proteins on the membrane support the viral binding. So scientists in this way, they're targeting the drug which can block the receptor and not allow the actual virus to enter, or not allow the cofactor to bind with the receptor to drag the virus inside the cell. So stop and prevent. So one line of antiviral drug will be like this. Second line, they are thinking that another drug which can prevent this drug as an antiviral, which can have the main protein, the main protease of the viral one structure. They have the protein amino acid sequences, one called MPRO. There's a main protease, one enzyme. This is one of the most important sites by which the damage actually occurs inside the cell. So if that MPRO is neutralized by some drugs or medicine, which can control, destroy, or neutralize, then the virus cannot be effective as such. So these two drugs, concept of the drug line actually now going on to do the research, and many other antiviral drugs which have been trial for other viral reasons are testing now. And some of the antiviral drugs are found to be effective in treatment. And this regards, I will tell another word, that one of the most controversial, it was not a controversial, it was made controversial, was hydroxychloroquine. This name is now, it's beyond doctors and scientists like us. Nobody used to know the full name of HCQ. Now everybody, child also telling hydroxychloroquine, including American president. So I'm thankful to him that he popularized this drug, but it is really controversial. Why it is controversial? Because this drug is a cheap, economic, easily available. Third world countries, poor countries, or growth, the developing country like India produces bulk of it. So this gives the common man treatment for malaria, which is many people will suffer, and Indian contingent and Africa are the place where this is a very important, most important disease, and people die. The falciparum, or which can the brain malaria, more than the people who are actually dying in the coronavirus. This is the fact. So tuberculosis patients die more as far as coronavirus death concerned, if you take the record. But we do not count. Our mind is totally on the COVID. No, forget about the other. So hydroxychloroquine, one of the actions that it actually make the cell more pH, means I think the students know what is pH. So higher the pH we call alkali, and lower the pH we call acid. So hydroxychloroquine actually make the cell inside more alkaline. An alkaline medium inside the cell or host cell always prevent the viral spike to attack, because this virus cannot tolerate high pH. So actually it has certain impact, but it has not been proved or tested, because nobody tested this hydroxychloroquine on COVID patient, because we did not know the virus earlier at all. So research is going on. But I will never say that this virus not work. And recently, New England Journal of Medicine editor-in-chief, Lancet editor-in-chief, two of the most respected global medical journal editor-in-chief say they were pressurized by the pharmaceutical lobbies in the America and others to write against the effect of coronavirus treated by hydroxychloroquine. Unfortunately, WHO echoed the same as the multinational drug company that does. And this is available in the literature. Both I thank to the two, Lancet and New England Journal of Medicine, that they confess that how they are pressurized to write negative publication, negative research publication against the hydroxychloroquine. So this is I think there are a lot of politics, lot of other factors, global equalizations, and the interest of a business lobby in the drug sector based on the US and China together. I will not give a clean sheet to yes. There is a connection between the US and China in this regard, make havoc for the understanding of hydroxychloroquine. But in India, doctors, as a preventive measure, we call prophylactic, it is using, and they're getting benefit. Therapeutic use, it is not still recommended, but many hospitals, they did it and they got a good effect. So definitely I will tell the drug treatments and all, it is going very well. Many of the things have come out. Research is going in this line. And last, I will be telling the next further questions on vaccine. You'll be asking, if you ask, I will ask questions separately.
Thank you so much, sir. You have already answered what I was supposed to ask. Like, are there any medicines developed for COVID-19? So you said at present there is no medicines as such for the treatment of COVID-19. So there are some advertisement going on in social media saying that take this ginger tea or lemon tea, so it will boost your immunity and it will stop the spread of coronavirus. So, are there any research going on this, or what we should consume? Like, we are getting lot of information on you should consume this, you should consume that, so that it will not affect us. So, what we should consume to stop the spread of coronavirus?
Uh, I think that you have come to the point of the nutrition as well as a diet, these two important factors in relation to COVID-19. I think you want to tell in this way. I will not tell that is an advertisement all the cases. Specifically, whatever the recommendation and whatever the advertisement, we are actually following. Indian and Asian countries, they follow it. We routinely follow the same type of drug. And personally, I will tell that we like to have the lemon tea, no doubt about that. So virus comes or virus goes, it most of the things, a material called a decadence of the whole content of many spicy ingredients together, which has been consumed as a kara. They called it in the market and people purchasing also. All over India, I have seen this is a common this one, which actually have all the ingredients which are very good for the health, and their medicinal plant like tulsi, basil they are using, ginger they are using, then dalchini they are using, cardamom and ilaj. So I don't think that our black pepper, they are already proved that they are very good in even, I remember in my childhood, my mom or my grandma used to give me any viral flu or that type if it happens to hot decoction soup or hot decoction milk with a lot of spice and all. We do not like it actually, but we have to swallow forcefully. So this culture of India, and I will not tell India, because I had a personally in 10 COVID-19 program under UNESCO Chair Life Sciences controlled from the UNESCO headquarters Paris, which I was a coordinator. Yale University coordinated and hosted the whole global program where 17 countries, 34 medical professors, scientists, they joined to chair, and which I coordinated for 2 months. 10 program, all are available in internet. So now this where we discuss and we find very interesting what the spicy tea and others were eating, drinking, same things Irani people, this young professor from Tehran University said that they are routinely does it and all. Turkey also said the same. The Istanbul University professor of medicine said that they are using it. So and also I found the Armenia where the herbal tea is a very common, like a Chinese and Indian, they routinely take herbal tea. And I was in Armenia. I have seen in Yerevan that even though drinking water also, they drink with the vessels. Vessels are put into the drinking water and they drink that water. So it is a culture of this Eastern Europe to Asian country in a common. Similarly, African country also does. Latin America, I have my own experience in the La Paz, Bolivia, Peru. I have visited and I worked there. So I have seen there. Their teas, you can find that the coca tea, they have it that they take for the tea, for the coca leaves. They take some unknown herbs like rosemary and others, they take it as a tea. Their tea is not like our Indian tea or British tea or these tea leaves. Separate ingredients they put and they claim as a tea. It has happened to me, and I was asking for tea. They got given me the tea with a tulsi smell I found and all. I could not understand what to do with this in the morning. So I think this is one of the reasons you can find out that Indians and these continental people may be affected. Infection they cannot prevent because of our lack of sanitation, lack of concept of the isolation and lockdowns concept. We have a lack of knowledge of the personal hygiene, lack of knowledge of this. The way we are affecting, the same way we're curing also. Our cure rate is also very high. Maybe one of the reasons that we are immune, I will use the word more than corona treatment, it is the immunization system works to defend the virus, which traditionally were experienced since long period from our grandmother, mother, and father. Same is going to repeat it. It is good. Overall, it is good. I don't tell it is an advertisement. Yes, somebody must boost it, not as a coronavirus treatment therapy drug, but as a immune booster or improve your health system to fight against any disease and disorder better. I agree with. But definitely, there is no drug has been discovered still so far on against coronavirus disease.
Yes, sir. Thank you so much, sir. And what are the innovations in design and development of medical devices? Because like we have seen lack of beds in hospitals and lack of ventilators. So are there any innovations like in a short time of period, so which has happened in medical fields, in medical devices?
Uh, Two-way, I will tell that to it is the how we manage COVID-19 in a medical hospitals or healthcare system, how we manage it. Yeah, this is one of the great challenge for India. Actually, people thought that we'll be managing very badly or very poorly, but practically we didn't do that bad. That is one of the things I must agree. Though I know I'm totally aware of the global scenario because I'm connected to the UNESCO and global pictures is very clear to me. I host it and many of the organizations, many of the things of the many countries. Infectious disease professors and scientists, doctors are known to me very well, and we are personally connected for that. But I agree one thing that as we have not done that bad management, that one of the reason is that the district and other administration did perfectly correct steps in the initial steps. But where we have gone wrong for spreading, that reason is that we did not understood the lockdown. And people are so much of less aware that how to protect themselves and why the 3 feet distance are required or 1 meter distance, they could not understand at all. I have seen many of the political leaders, they took the photograph published in the newspaper where they are connected with each other, hardly 10 centimeter difference. So why it is all are not aware. So we did that mistake by not properly control the coronavirus spreading, because spreading part we made a blunder because lockdown was not perfect. Objective was very perfect. Time was, I will not blame the time. We actually could have been done 2 weeks back, but it is not that bad time also. But later it has been spread. So fortunately, what happened? The virus also have lot of mutations in this period, and the lethal size. What it has shown the impact in the European countries, it has not done that in Asian countries as such in that above way. Spread is very high. So hospital they able to manage one of the reason that our entry of patients and exit of patient of the hospital almost same. If you take out any hospital, including my own hospital, the teaching hospital, which we are having 250 bedded dedicated COVID beds. Okay, and the 3 different layers it has been taken. These layers are specifically only you can find out the 4.1% people suffering from the COVID positive are actually required ventilator. It is a global scenario. India may be less, but it's a global scenario, not more than 4.1% required for ventilator. So that problem of that we did not have adequate ventilator earlier prepared, never thought of it. So that mistake has been corrected by government of India with the innovation. IITs are involved. One of my friend, my junior, is a chair professor at IIT Kanpur, with whom I have a collaboration also, our university collaboration. He has been given responsibility with a company for produce the ventilator, and they produce huge number of ventilator in the market. So many institutions have come to rescue for ventilation production, and many handmade, easy available bedside ventilator in a rural place can also be prepared. So we were depending on the international, even our prime minister, our country heads, they actually initially asked the support of the mask also from the China and other, and kits also from China. And we got a horrible kits which is not able, can be protected from Chinese kits. It has come like that way for PPE. And they have given the same quality material to Italy also. They shouted. So they stopped all. Once we started, Indians have the unique brain, and this, actually speaking, the mind and the brain, if it's synchronized, it can do wonder. India did that wonder. They have completely controlled. Now we have no deficiency of the mask, N95 mask. We have adequate ventilator in almost all hospitals, because
Yes.
even the patient number is going, because we have a high rate of recovery also and low rate of death. So in this condition, we able to manage it very. So technological evolution on the medical field, the ventilator part has been taken care of it. Hospitals have been totally changed. Means change means made the hospital where the infection disease part is separated from the other zone. So spreading that this technical side is a very important for the construction part of the hospital building. Reorientation, rearrangement, realignment of a hospital setup, which earlier was different, now which is a COVID made us different, to segregate the separate the people. And the experts training properly has been given. So innovation part, if you see the medical, I will tell the some of the technological part engineers have, I will actually appreciate engineers equally as medical scientists and doctor. Huge contribution, enormous contribution from engineering institutions, IITs, NITs, and good organization, companies like Mahindra, companies like Tata's Locomotion, all has come to rescue for preparing the things like keys or ventilator, which they do not do it, but they did a wonderful way they have done it. And hence, I will tell, it has made the changing mindset of India, which our Prime Minister actually appreciated and told us to Atmanirbhar Bharat. So I think that he wanted to tell us that think your own potentiality. So Indian now really thinking their own potentiality and fighting their own battle of corona, their own field in a different way. Though the virus we have not imported, we have not got it from our own, we have not created. Virus come from a country called named China, but we are affected. Globe is affected, but we have fought, and we did not too much of depending on the other countries. And second innovation is, you might be seeing that the shield, preparation of the human face shield, another. And you see now almost all the chemistry department of any college or university, even PUC college also, I heard in India, preparing sanitizer by themselves, preparing their own sanitizer by themselves. I can tell you that my engineering college, BLD Engineering College, Department of Chemistry is producing the sanitizer, then supplying the whole college. And I can tell you that my institution, Pharmacy College, produces own sanitizer, and which is given to almost all medical college, including district hospitals, they have given for supply. So this is Atmanirbhar Bharat. This is the innovation. We have an innovation mind. Innovation does not mean that create a new thing. Use the new thing in a shape and reshape and make use refined in a better improvement of the human being. I think we really did very good in the medical field concern. Other innovative part, I will tell, that is the IT sectors. There is a revolution has done in the IT sector. Now you and me, now we are connected with the multiple students and other, by whom? By internet and Zoom or Microsoft Teams or local. So whatever we did, huge innovation has come for making it more viable, economic, user-friendly chain to set up some of the things where the patient, doctors, and all can come out. And medical field, it has been make it in the online treatment. We called telemedicine earlier. It was never that much of popular. Now we got M-health, mobile health, or you can say digital health. The concept of digital health, really it has come now. Many patients now not going to hospital, they are getting support from the doctors by different way, but advice. But it is also costing, because many patients are dying because of non-availability of the hospital bed for them, because it's the COVID bed and transfer. There's a chance of that. Many important operations are also, except extreme emergency, are not being done. Many patients like cancer patients who need a long-term therapy are also being affected. So I will tell, there are a lot of pros and cons, but there are certain innovative things we have done, specifically the digital field, engineering and technology field, and consultancy and approach to the patient doctor's relationship. That is again an innovative way we are doing by the mobile health telemedicine. I think many things we have changed.
Yes, sir. Sir, your audio is not audible.
Are you hearing me?
Yeah. Now I am getting you, sir.
Okay. Yes, I have given this that I feel that we have done innovation, whatever the best way possible, global scenario. We did our best with the resource which we have, but I think we have to think for the long term. More virus may come, more lethal virus may come in future. We have to prepare it this way. Innovation will never stop. Innovation is a dynamic process.
Yes.
Whatever I invented today, tomorrow it will be reinvented by others. That concept India now understood. I think is a very good positive side of the one COVID is that we have an innovative mind.
Yes, sir. Thank you, sir. And so I would like to take one question from the comment box, and it was
Yes.
even my question also. Like, all are waiting for COVID-19 vaccine, because whenever we hear news about vaccine, oh God, when it is going to end? So please tell us about the latest innovations of COVID-19 vaccine, and how long it will take, and what is the process for to find a vaccine, and how many phases are there to find the vaccines?
Yeah. You have asked a very important question, and I will tell this is the most curiosity now in all over the world. It is, don't think only Indians are thinking like this way. Entire world is actually now asking for vaccine. But problem of the vaccine is that the vaccine against the virus, very few vaccines are successful, like smallpox vaccine. Most of the vaccine, even after 40 years, still we do not have HIV or AIDS vaccine. So you understand the gravity of vaccine preparation. Not even Ebola viral vaccines only successful tested, and it is using. Other vaccine in the recent years, nothing has been found positive and given a good impact on that. So, and this is a RNA virus with a single strand and a short protein structure. It can change its structure anytime, and it is doing it. Actually, last week in Malaysia, they found a different strain of the virus, which is more lethal, 10 times lethal than this current coronavirus. And those scientists, they're connecting with the NUS Singapore. They have predicted if this virus spread, then they will make the 10 times impact of the death rate also. And it is completely different virus, and this will not work as against any of the vaccine at the moment. I think at the moment around, so far my data concerned, it is, I think, around more than 200 of the real clinical trials are going on the vaccine discovery. None of the vaccine will be suitable for the viral strain which they found, and the genome sequence they have isolated. They said no vaccine will work on this virus if it is spread. So we cannot completely rely on the vaccine, number one. So trust your own system, healthy isolations, self-distance, and also the personal way to behavior more important than vaccine. And what some other vaccines at the moment are popular, one is the Oxford vaccine. So Oxford University vaccine still in the phase 2. I will tell you what is the phase 2. The virus or any of the clinical drug, when it is come for use of the therapeutic use for the patients in the market, certain things have been taken into an account. Based on that, we called it as a clinical trials. I think it will be good for the students who are listening here. Clinical trials. Now, the clinical trials having 4 stage. Clinical trial stage phase 1, phase 2, phase 3, and phase 4. Before clinical trial, we have in silico and in vitro method. In silico is the computational biology and mathematical model of preparation of a drug or vaccine. In vitro, using it in the external petri dish, I can say, in a petri dish to culture or some medium, use it in not in the system of a live. Then preclinical study goes to the in vivo, that is on the mice or rat, injecting and see. Then it goes to the clinical trials, human. This is the common. This stage is called preclinical. Then clinical trial, when it starts, it's stage 1. So phase 1 normally selected from around 20 to 60, 70 people. It has been, trial has been given one location. Then go to the stage 2, that is called phase 2, where at least 300 people minimum should be involved, and 2000. Then it go to stage 3, where more than 3,000, 5,000 people should be involved for testing. Then it goes phase 4, where phase 3, if it is approved by the government, then only the drug is recommended for that country or that. But actually what company and government and multi-center pharmaceutical company, they do it, they take this drug from the second phase to different countries, because phase 4 wants the global aspect. Now you have prepared a vaccine in Russia, like Sputnik 5. Okay, they claim that they are working with the India and all. We do not know. It should be very clean and clinical trial registry available in the internet that should be uploaded. So we have no idea that Russia has contacted with how many people they have tested and all. Because global variation, ethnicity, race, all makes a matter to acceptability of the virus, antiviral vaccine on that person. So if Chinese vaccine may not be affected to the Caucasian because they are Mongolian, they may not be affected to the Caucasian or African or Afro-Asian. Genetic things may not accept it. That is the reason clinical trial phase 3, phase 2 to onward, it started the multicentric study, and phase 4 is absolutely different countries separately, and final report accepted. Unfortunately, right, the Russian vaccine Sputnik, what big show and the photographs and the president involvement did not cross second phase to third phase. Okay, so it is stopped there. So you understand that 10,000 people should be actually in the trial for the third phase to fourth phase. So where multicentric study required. And forget about multicentric study, it is not even done in this place. Am I audible? Am I audible? Can I wait or can I talk? Okay, so this is the reason I would like to inform you very clearly that vaccine which has been found so far are is the phase 2 and phase 3 status. And there are multicentric now they have done, like Indian vaccine, which is actually we call the Covaxin. This is the Bharat Biotech and National Institute of Virology, Pune. Together, the Bharat Biotech has taken the Covaxin, or name is also given, and it is very popular now. And it has crossed the second phase and all. But still, none of them has come to the third phase complete certifications. And once it is there, the government should certify, then it is go to the fourth steps. There's the all the world, they should do the same test on the person. Now the problem is that the testing and the clinical trials, the volunteers are not easily available. Specifically, many countries, India, it may be very available because of the populations and all. Western countries, people are not going to accept the clinical trial volunteer. Actually, they are being given the fees for being a volunteer, and that is an enormous amount of dollars have to pay to the person who has been volunteered for the vaccine for any of the trials or any clinical trials. So this required huge monetary resources also. But only one good point and plus point of that, understanding the need and emergency, people have now become more aware, and government is more cautious, and they're making it as fast as possible. But they cannot bypass one of the clinical trials phase and directly cannot ask the whole world to accept it. It will not accept. Even WHO also not accept it as a global vaccine until all the phases it goes with a required number of people, required number of multi-centers. It has been tested, and so this is the story of the vaccine. Did you able to contact?
Yes, sir. Yes, sir. So,
Geeta, I have
when are we
completed
expecting the vaccine, sir?
That's the reason. Just now I told that expecting vaccine is I will tell that too much expectation from the scientists and all. It is not that from the sky it will come or the heaven it will come. Because even if you put a patient, India may give quite a good number of samples, because we do not have that much of problem in the Western country where the volunteers of the clinical trial have to pay in dollars to become the clinical trials part of it. India does not require so far. They give a very less this one. So, but you are not recommending this virus for global acceptance, because until the countries globally, it has been tested in all race, community and all. So that needs a time. That needs a time. So whatever you speak and whatever you tell loudly, or like the photodrama or show that giving vaccine to the daughter, son, it will not work until it is tested in the different race, different culture, different peoples. It should positive with adequate number, and WHO must accept, and specifically from our government acceptance will make only for our use, but to global use of a drug like smallpox vaccine, not discovered by India or anybody else, it has come from the Paris. So though it is globally accepted, that global acceptance required. China cannot claim that I have prepared a vaccine and take it. There's no. Their need that vaccine should be affected in our people. And rest is the history that we do not know whether the vaccine ultimately how much beneficial it will go. But vaccine or without vaccine, any viral disease, it automatically it goes. And CoV-2, SARS-CoV-2 also showing the same. Only I will tell you 70% of the people does not require actually any treatment, only symptomatic. They don't need. Oxygen you require maximum, you can require 4%. And that is another few percent you require for the ventilator is not more than 4%. Oxygen is also not more than, and oxygen required for 15% people you require. Other like ICU also require the less. So only 65 to 70% people actually are not required anything. Even they are asymptomatic, as we say, even they do not have the problem also showing signs, symptoms. Only signs, symptoms, they can home isolation or isolation in a proper place, proper way, they can cure. And symptomatic fever, they can take the medicine, antipyretic medicine and all. Antiviral treatment should not be given when the symptoms are not that severe. And there are severe cases, there are many other interventions like steroids are given, because to stop the cytokine storm, this is one of the dangerous part of the severe acute respiratory syndrome of the patient who has actually stopped all the helpless condition when there is a severe respiratory breathing shortage. In that cases, it has been found the steroid is one of the phenomena by which it has been treated, which is very cheap and economic. So drug reasons, too much of costly drug not required, antiviral unnecessary therapy not required, complete medical care required by the medical guidance from the doctors, not by the quack, not by the people who have no knowledge of the modern medical sciences. It required modern medical sciences here, because to rescue who required oxygen saturation based on that, the additional oxygen, who do not require, who required admission to the ICU, who do not require, who decide? It is doctors supposed to decide. It is that medical team. Here, other people should support and others. But therapeutic point of view, COVID-19 has clearly made a demarcation. That's one of the reasons many doctors are affected. Why they are affected? One of the reasons of the affecting is the viral load. I stay half an hour with one person with a COVID without knowing it, with a distance of 1 meter. My chance, even I was wearing mask, he was also wearing mask, chance is only 5%. So why doctors are affected? It is not always because of the wrong PPE and all. Yes, PPE is one of the precautions required. It is too much of troublesome to wear. Doctors who wear PPE, they know that what difficulty they sweat and they struggle. So one must have a respect to medical doctors and our community with a respect and regards that we fight against the odds, against the wish of our own family members and other people, because we have taken a challenging profession, we have taken a dedicated profession. But we feel hurt when we are being blamed after death, because they think that we did not do it. It is not like that. We require support, we get the support and all, but most of our mindset should be very scientific and clear, transparent mindset. I feel with this precaution, we have to be taken care of it, and definitely we able to do it better way. So don't expect the vaccine will come and rescue us. or don't expect that without treatment also we'll go out if I am having severity. But don't be panic that, oh, he has a, or she has a COVID, she will not survive. Absolutely wrong. Survival rate is far higher than the death rate. Is only lethal is only 4% in the globe. India is lesser than the global average. So I think the Indian people die in the tuberculosis more than that percentage. So in this way, we have to control.
Yes, sir. Like one more question is from Dr. Aishwarya. Which is more effective to treat COVID-19 patient? So,
which is more effective to treat?
Yeah, sir. Which is more effective to treat COVID-19 patient? So it is the question from Dr. K. Aishwarya.
Because he is a doctor anyway, but I could not understand the question. What way to treat? Is it the treatment by the therapeutic point of view treatment, or discovery of the drug and this one the treatment, or precautionary measure while doctor themselves to take and the patient themselves to take, the relationship between patient and doctors in this way? So these questions, I think, difficult to answer for me here, because the platform is here is the students and they are the PUC and schools children. So I don't want to discuss it complete medical terminology here to make them. I try my best to convince the people in a very easy way that they can understand the COVID science.
Yes, sir. Yes, sir. Thank you, sir. And one more last question from the comment box. What is your opinion on reopening of the schools?
I think this is an excellent question, and I think you can give the answer better than me. You are in a better position than me to give the answer of this question more than me.
I think until we get a vaccine, it's
Actually,
not.
Please tell, please. I want to listen. Please tell. What is your opinion?
And get a vaccine, it is not good to restart the school. That's what I feel, sir. Because it is difficult to like the kids, especially the primary. So, what is your opinion, sir? This is what I feel.
I think that one point that COVID has taught us that distance learn very well, and COVID has taught us can interact and get the knowledge from sources, because the innovation part, your innovation part of the COVID is totally make globe into one platform in a one film of a laptop and a mobile screen. But one thing, the students in the schools, children, they require their teachers and their personal contact not only with themselves. A school child is growing along with the society, and the community itself. When I was in school, I loved to go to school not for the teacher always, but for my fellow friends with whom I play kabaddi. Understand? This is required for human growth and development. That part will be missing if students are not completely going and avoid for waiting for the till vaccine to come. I think the time has come. We have to find out innovative way, different way, small module, or you can say the small group teaching in this format. You have to. We cannot, because of Corona, cannot take away complete a small kids his childhood. He or she should not sacrifice her childhood, because we used to play. Our children are now not playing 6 months with the okay, but situation will be coming back to normal, and automatically the system of immunity and system of our adjustment will be developed. This will prevent us. It is should not be the till vaccine comes, our children will not go to the school. One problem of that, students are going to the school not for only passing exam. They are going for becoming a good human being, a citizen, a scientist, or a doctor, or like us or you, a teacher. It grows it from that nutshell. Don't disturb that nutshell completely shake. Wait for some time and make an arrangement. Make see that they are being communicated each other. They should not feel isolated and completely alone. Our Indian children have been gifted because we play too much, we work too much with the students and our teachers and all. That is not in the all type in the Western field. So let our children get that benefit. So I will not completely agree with you in these terms. That I will expect that discovery of the virus, antivirus vaccine of the virus is a long term. Alternate pathway to make the small group teaching and the localized cluster teaching, or even the teaching in a group where all are being medical precaution should start and initiate. For that reason, lot of fund money required. I will request many organizations like Sudhamur, Ajim Premji Foundation, fund all the great people of our this to come forward and support the school children more to get back their childhood at least 10% of their needs.
Yes, sir. Sir, I would like to add on to this that from Agastya International Foundation, we are reaching to students through TV program, and we are also taking online sessions for government school children. And we are trying to get the permission from government of Karnataka to conduct classes in temples or school for
Open air.
less number of students. Yes, sir. Yes, sir.
Open air, like our
Yeah.
Gurukul what
Yes,
is
yes.
taught us, and Rabindranath Tagore has taught us in the Shanti Niketan under the banyan tree. I think that time has come, because locked room, locked environment actually make the COVID worst. Open environment by the nature, it will not affect. Impact will be low. I think that nature has given us the lesson. Go back to the ancient wisdom.
Yes, sir. Thank you, sir. Thank you, sir. And we are reaching students through our online and offline sessions through college volunteers. Also, we are reaching the students, sir. And we are conducting sessions in science, mathematics, and environmental science, sir, at present for the students.
Very good. Excellent, this one. Thank you
Yes.
very much for excellent this one. You must go ahead with that one.
Yes, sir. Thank you so much, sir. And I would like to thank Dr. Kusal K. Das, sir, on behalf of Agastya International Foundation. Thank you so much for your precious time. Hope this pandemic situation will end soon and we will go back to, like, children will come back to school with happily and everything.
Yeah, I'm concerned.
Will go on
I'm
smoothly.
concerned with that. I'm concerned on that.
Yes, sir.
Very
Yes,
much
sir.
concerned. Thank you very
Yes,
much.
sir. Thank you everyone for joining us today. Let us meet in next Innovation Express webinar. Stay tuned to our YouTube channel. Please subscribe to our YouTube channel and like our Facebook Agastya page for more